name is Dr. Howard Freeman. I'm a GP in Merton. I've worked here in Rains Park for about 30 years and I'm currently the Joint Interim Chair of the Merton Clinical Commissioning Group, which was formed in November 2011. Merton CCG is a membership organisation of all of the practices in Merton, and the vision is to make sure that all of those practices have a voice in the CCG, to make sure they feel included in the CCG, to make sure they always own the CCG, and more importantly to make sure that their patients through the practices and directly can input into the CCG. Our priorities are to ensure that we have a structure which everyone feels comfortable with, to ensure that underpinning that structure is a vision that everyone supports, to ensure that we are confident that we really do represent the views of all the practices in Merton and all of the patients in those practices. Authorisations the process which actually says we are fit to go out and do it all ourselves and to start developing further our vision. I always think that authorisations are a little bit like children getting their car licence, and they no longer need L plates on the car, and we're looking forward very much to that point, so that working with our commissioning support partners, we'll be able to go and put the vision into practice in Merton. I think there are a lot of challenges over the next few months which are absolutely critical for us. We've got to make sure we keep the practices engaged, we've got to make sure that the vision is correct and we stay true to it. We've got to make sure that we jump all the hurdles towards authorisation. We've got to make the vision a reality, get some flesh on those bones and get a team together. Most importantly, we've got to make sure that we take some of the excellent talent currently at NHS Sutton and Merton with us into the new Clinical Commissioning Group organisation and the Commissioning Support organisation. I think benefits in health are frustratingly slow. I'd be lying if I said that on the 1st of April 2013 they will see a complete change in the healthcare provision for Merton, but what I hope is that incrementally over the next 2 to 3 years after that they start to see changes. I think some of those changes are already happening. I'm looking forward to the Nelson Hospital redevelopment. I'm looking forward to the Mitcham redevelopment on the Birches Close site. I'm looking forward to Lambton Road Health Centre opening. I'm looking forward to more involvement from Kingston Hospital in West Merton and more work between St George's Hospital and Merton CCG in East Merton. I'm looking towards the extra work that we're going to do with the borough, as they are very keen to support us in achieving some of our vision. I'm also very conscious that there are issues we have to resolve about the community services in Merton, and we want to work very closely with the Royal Marsden Foundation Trust to change community services to support practices to deliver more care in the community in Merton.